everyone. Okay, in my last video, I mentioned sickle cell disease or sickle cell anemia. Okay, I was teaching about sickle cell disease and or sickle cell anemia. Okay, and I may mention that sickle cell disease is a group of inherited red blood cells disorders. So today I'm coming to talk about some few types of sickle cells we have. We have HBSS. Okay, the HBSS type of sickle cell disease, okay, they are inherited. This type of sickle cell inherits two gene, one from each parent. Okay, hemoglobin S is an abnormal form of hemoglobin that causes the red cells to become rigid and sickle shape. Okay, and this type of sickle cell disease is the most severe disease. Okay, the SS, I mean the SS, they are the most severe type of sickle cell disease. Okay, so anyone with sickle cell SS or a carrier of SS, you should take care of yourself. You shouldn't play around. You should be vigilant. Okay, the most severe one. So we have the HBSC. The HBSC, please, I'm doing something at the background, so don't mind. Just listen to the education I'm giving, okay? So the HBSC is the type of people who inherit hemoglobin S gene from one parent and a gene for a different type of what? Abnormal hemoglobin called C from the other parent. And this type is the mild type of what? Sickle cell disease. It is the mild type. Okay, so this one too is also a type of sickle cell disease that other people also suffer from it. Okay, so you being positive of sickling, you should know the type under which you fall so that you know what to do and what not to do. Then we have HB beta thalassemia. The HB beta thalassemia, these people inherit a hemoglobin S gene from the parent, and then a G for beta thalassemia, which is also another type of hemoglobin abnormality from the other parent. Okay, so when you take HBS beta thalassemia, we have two types of this sickle cell disease. We have HBS beta 0 and then HBS beta plus. Okay, so the HB beta 0 thalassemia usually have a severe form of the sickle cell disease, and then the S beta plus thalassemia tend to have a milder form of sickle cell disease. Okay, so these are just the few types of what sickle cell. It's not anything. I just speaking about the sickle cell I introduced to you yesterday. I didn't mean to go to bring you the types because some people, though they are tested positive of sickling, they don't know the categories in which they fall under. So I just brought these few types, or I just reviewed these types for you or whoever is suffering from sickle cell anemia or disease to know. Or even if you don't know, it is now opportunity for you to go and find out the type of sickle cell that you fall under. Okay, so I'll be mentioning some few symptoms of sickle cell disease in babies. Okay, so if your baby suddenly develop pain in the belly, in the chest, in the arms, and then fever greater than 38 degrees, you shouldn't take those signs or you shouldn't take those symptoms for granted. You just have to take your baby and run your baby to the hospital for tests to be run and see what is causing those sudden pain in belly, in arms, and then in the chest, and then the temperature too must be taken notice of. Then baby can be diagnosed of sickle cell disease, a sickler or someone who is suffering from sickle cell. Okay, because this sickle cell disease is a lifelong illness. Okay, the only way treat or to manage this condition, it's the bone marrow transplant and then the gene therapy. That is the only way a sickle cell disease can be handled. Okay, please, you're watching my video on sickle cell disease. Please, I hope you're enjoying the sickle cell. Maybe my teaching could not be that well for you to know, but at least me mentioning something here that sickle cell is one of the deadly disease. You have to go and find out your sickle cell status, whether you are positive or negative. If you are negative, you are free. But if you are positive, please probe again, find out the categories under which you fall. If you fall under the SS, or you fall under the SC, or you fall under the S beta thalassemia. Until then, I'll see you in the next video. Thank you. Have a good day.